in those sites. And what we found after 2 years intervention, that more than doubled. If you compare the control group, which was 9% across, and that moved to 20%, the yellow arrows there depicts whether it has gone down or not, and the blue and red are baseline and end line in the same slide. We also took a gender dimension. We looked at fathers' engagement in daily care of the child, and that decreased in all sites. At the end, you'll ask me questions why. While I'm presenting, I don't know, but maybe at the end I will become wiser. And that went down. 3 or more children, books in the home were very low overall, both at end line and at baseline at end line, and both in control sites, that was overall. But at the end, in 2017, we see a significant improvement in households with books. Probably that could be attributed to our massive campaigns on the importance of emergent literacy and numeracy to early childhood development. The other issue we measured was whether the issue of play. And we put a cutoff at a household having 2 or more things that children could play with. So we measured that at baseline and at end line, and that was a very significant increase in the households. And that could be attributed to the program that promoted homegrown solutions to play, including partnership with Umuhuza, where local materials were being used to promote play in households. Children exposed to inadequate care increased in control and in ECDF sites. We measured inadequate care in terms of children left home alone or left in the care of another child who is 10 years or less. We considered that inadequate care, especially if they were left for more than 2 hours. That had improved in ECDF sites. Children exposed to any violent discipline increased in both sites. So it's not always that you get the results that you want. Of course, we wanted that to decrease. But at the end of our program, it increased when we measured. And we'll talk more about that. And the increase was significant. We did a qualitative intervention and found out exactly what transpired. Now, from actually disciplining the children, we wanted also to know from the parents what they believed, whether physical disciplining was a good thing or not. So belief that physical punishment is necessary to raise a child well was stable or marginal, and we saw marginal decline in ECDF sites, but increased in control sites. So what went wrong? The parent belief was improving that physical disciplining was not the way forward, but the actual disciplining was high. Anyway, we moved away from that and we look at child health. In terms of child health, we look at the prevalence of fever, which was unchanged, and the mosquito net prevalence declined in all sites between the design of the program and the intervention period. That's another thing. Mosquito net usage at the time of starting the project was high. At the end of the project, it declined. Decreased prevalence of diarrhea and cough in past 2 weeks in ECD and F sites. We're doing very well, as you could see, from 52% to 48% at the time of endline. We move away from that. We look at family environment and caregiver well-being. Conflicts in the home in the last 6 months decreased in ECDF sites compared to the control sites. Conflict as a toxic additive to child development, which inhibits and hinders overall child development in homes, was one of the measures of the family environment that we undertook. And not surprisingly was decreasing in the ECD and F sites compared to the control. Caregiver mental health showed a similar downward trend at baseline and at endline. This was postnatal, partum mental health. In nutrition, we saw declines in stunting for children aged 48 to 59 months, seen in both control and endline. So in both control and endline, there were some significant declines in stunting. And there could be very interesting reasons for that decline. And you see in the control, at the endline, it was 40%, a little bit higher than the national stunting average, which is currently at 38%. Prevalence of acute malnutrition, stable over time in all sites. No significant change recorded. Children in all sites more frequently meeting minimum dietary intake, and that improved over the period of the interventions. Household food insecurity on the rise. Food insecurity. So while stunting was going down, food insecurity, and that probably could explain why there was no change in the prevalence of acute malnutrition. So food insecurity was on the rise. Prevalence of underweight increasing in all sites. Water and sanitation, WASH. Increased access to sanitation in all sites, but larger improvement in ECD and F sites. Access to improved water resources in both, but more in ECD and F sites. Fixed sites for hand washing in homes quadrupled in ECD and F sites compared to the control. Access to services. What my predecessor presented, they do service delivery. And that is a typical stimulation room in one of the Imbuto Foundation sites. Percentage of children who attend any organized ECD or early learning programs in all the 10 sites. And significantly, as you could see, from 16% to 36% at endline. Percentage of households with any insurance coverage increased in ECD and F sites, but decreased in control sites. Conclusions. I tried to make in 10 minutes. I think I tried to make some serious adjustments. Significant improvements were in access to ECD services, including in the poorest of the communities and poorest of households. The setting of this ECD program was to target the communities whose children were at risk of missing out on early childhood interventions. So they are deliberately targeting those family-households, and we saw an increase in that. Family care practices, activities that support learning. We saw parents getting more involved in supporting their children to learn. Feeding practices improved, though the availability of food decreased. Household food security. Changing beliefs around physical punishment, but not in behavior. That's what came out. So the belief changes, but the behavior does not change in 2 years. What does it tell us in our design of the project going forward? Child's